Hey, welcome back. Dr. Watts again here at Body Synergy Wellness Center. Today we're going to talk a little bit about chronic fatigue. A lot of patients that experience that, and there's a number of different reasons that can cause that. So just briefly, I'm going to touch on a few things that can cause that, or actually in some cases I have patients that have a combination of 2, 3, even 4 of these things causing it, which results in major fatigue. So we've talked about it before a little bit. Vitamin D. Vitamin D, if you have extremely low levels, can cause major fatigue. Anemias, B12, iron anemias, those can cause fatigue. And as we know, a lot of patients, they get diagnosed with fibromyalgia. And with that fibromyalgia, they get the body aches, and some of them experience fatigue. Well, fibromyalgia really is not that much of a diagnosis. Really is a diagnosis of we don't know what you have. So you have fibro, tissue, myalgia, pain. Basically is what it is. But there's a lot of different things that can cause that, and a lot of different things we can do to fix that. Aside from that, so we've gone over vitamin D, B12, anemia, iron anemia, fibromyalgia, thyroid. We've talked about thyroid before. And one of the other things we haven't really talked about, which I see more and more of with patients, especially with women patients for whatever reason, I seem to see a lot of this with women, is patients that have been experiencing fatigue. It's been coming on for a number of years, and here they are 5 years later, 10 years later, and they've just been dealing with it. They've tried all sorts of different medications, to antidepressants, to anti-anxiety, all sorts of medications doctors have put them on to try to control that. And a lot of them are starting to show up with a virus called Epstein-Barr virus, which is mononucleosis. So people have had mono, and that's one of the first questions I'll ask when people come in with chronic fatigue is, do you have mono? Or have you had mono? Like when you were a teenager in your 20s, did you ever have mono? And a lot of them are like, oh yeah, I had that. I was sick for a few weeks, felt really bad, and then it cleared up. Well, mono falls in the same family as like the herpes virus, where don't worry, you don't have herpes if you have mono. But what it does is it can clear up, but it's still in your system. It just lies dormant. And so later on, with the different life struggles, whether it's a lot of stress or just adrenal fatigue or immune function has decreased, mono can wake back up. And it wakes up though in a chronic stage, not in that acute phase where you're downtrodden for 2-3 weeks, some people even a month. But what it does, it just kind of sits there and lingers, and you have these very mild, like mono type symptoms of just fatigue all the time, but for years and years and years. And so we run simple tests to verify that and check that out. So if you have any questions about that, experience chronic fatigue, give us a shout. We can definitely run some blood work to find out, is it anemia? Is it vitamin D? Is it thyroid? Is it mono? Is it a combination of some of those? Either way, a lot of that can be easily verified and figured out through blood work and through different exams and stuff. So give us a call. Love to help you out. Otherwise, stay tuned for next week, because next week we have some great news coming online here with patients being able to have direct access to these nutraceutical companies who only sell to doctors. So pretty soon here, by next week, you'll be able to go online and order supplements from the companies that normally I can only get supplements from. You can order directly from them, have them delivered straight to your house. But we'll talk more about that next week. All right, have a great day.